Hello, dear colleagues. Good morning, good afternoon in this virtual session. My name is Raminta Shtuikite. I am the chair of the Global Fund's Technical Review Panel. I want to thank to you for giving the possibility to the Global Fund's Technical Review Panel to present its observations based on the TRP reviews from the last 3 windows. Last year, the TRP made a presentation about the reviews and what we have seen and what recommendations we have based on the largest windows of the grant cycle 7 of the allocation period 2023-2025. And the full report of that observation report, also from window 1, window 2, remains available on the Global Fund's website, the TRP section. Additionally, nearly half a year ago, we did present our observations from the review of the COVID-19 response mechanism portfolio optimization wave 2 reviews. And today, you might be surprised why another presentation. Normally, you hear our lessons either early in the cycle, already at the very end of the grant cycle, of the 3-year grant cycle. However, this time we thought that it might be useful for the technical partners and the Global Fund Secretariat colleagues to hear our observations from the last 3 windows without waiting until the mid-2025. And the TRP today is represented by a whole team here, including the 2 vice chairs, Ernest and Shin, and our expertise area focal points. So we call it focal points for HIV, for TB, for malaria, for equity, human rights, and gender issues, and for efficient and sustainable systems for health. We want to extend our warm thanks to all who participate here. And also I wanted to extend very warm thanks not only to the TRP extended leadership, but also to the colleagues from the TRP Secretariat for making this presentation possible today before some might be starting a holiday season or football season or Olympic season. This is particularly appreciated because our TRP review window 5 finished last week, and the TRP is still working on finalizing its review and recommendations forms for that particular window. And if we go to the next slide, in terms of today's agenda and process, I will introduce key data for window 3 and 5 and remind key messages from the previous cycle, from the previous windows of this cycle. And our colleagues from each expertise area will also help to reiterate what we have observed and how much synergies or similarities they have seen in window 3 and 5 to what we have heard in window 1 and 2. Then we will move to our thematic lessons for these last 3 windows, and these are urgency of sustainability and planning to be presented by Shinsuke Miyano, followed by challenging operating environments, and then refugee and migration populations presented by Ernest Nyamato. And I will speak to the TRP point about potential for better integration of malaria interventions between the Global Fund and Gavi at the end. And then last but not least, we will have a session on questions and answers. Please post your questions that you have in the chat. The Global Fund Secretariat colleagues will capture them in a slide deck and then will help us to facilitate us to address them immediately after this presentation. And we are really delighted that it won't be only the TRP leadership, chair and vice chairs who will be answering, but we have all expertise areas are represented here by focal points who will be able to address any questions based on the expertise area. Before we move with further slides, I wanted just to highlight that in addition to questions that you can pose, please note that we will have the slide deck available in English, Spanish, and French. It will be shared with everyone who has registered for this Zoom session, and that will take place next week. We are waiting for the translation of this slide deck to happen, and then it will be immediately shared. So without further ado, let's go to the next slide. And this slide will show you where we are. Okay, so I think that next slide is not this one. Okay. There is a little bit of change of the order from what I remembered. Okay, so let me speak to some, exactly, that's I think the slide. So where we are in terms of the grant cycle 7 and funding requests reviewed by the TRP, you see 5 columns that represent each of our windows. So far, we have reviewed 168 funding requests that in the cycle, and that represents roughly 85% of all funding requests expected in the grant cycle 7 from applicants, and that represents around 90% or even more of the allocation plan for this grant cycle. And then if we look and zoom in into the last 3 windows, we will see that 62 funding requests were reviewed, and those were 24 tailored for focus portfolio, 12 full reviews, 11 program continuation, 8 tailored for transition, and 7 tailored for national strategic plans. In all those 3 windows, I'm glad to inform that the TRP review outcome was that all funding requests, all 62 were recommended for grant making, and 2.7 billion was recommended, which is representing around 20% of total allocation in this grant cycle. Additionally, matching funds were approved, recommended for grant making 55.1 million, and multi-country funds from catalytic funding 5 million. If we go to the next slide, please. So you see that in the windows 1 and 2, the majority of funding requests were from the orange and purple countries. Orange representing high impact. What the Global Fund terminology means that high impact and key for the mission of the Global Fund. And core is also significant investments and very important for the Global Fund's mission. But the green part in window 1 and 2 were focus countries, or were representing relatively small portion. However, that changed, and in window 3 and 5, we have seen much more focus portfolios. So a lot of our lessons learned are much more relevant and coming from those reviews of focus portfolios, which were majority of funding requests. And if we go further, next slide. Okay. And as you know that overall, the TRP is conducting funding request quality assessment of each funding request. And what you see that similarly to the previous first 2 windows, in the last 3 windows, we also saw high quality funding requests, which deliver strategically focused and technically sound responses that are aligned with the epidemiological context and maximizes potential for impact. This is representing that the green color means actually the funding request quality was overall either very good or good. And then in the next slide, we show normally to you from the quality survey what TRP sees in funding requests in terms of the focus on resilient and sustainable systems for health. In the last 3 windows, where we have also quite a number of focus countries, majority focus country portfolio. We saw that strategic focus on resilient and sustainable systems for health were seen as strong or relatively good in 75 funding requests, 75% of funding requests. And in comparison with the window 1 and window 2, that number was 82. So that number was higher. And the interpretation of this qualitative assessment might be also that focus country portfolio have fewer investments in RSSH, and that might have influenced the assessment on the strategic focus on resilient and sustainable systems for health, the first line, which is like 76, or focus on RSSH in terms of whether the focus is really on system strengthening rather than system support. In the last 3 windows, we saw fewer funding requests in the TRP's view that had the focus on system strengthening, with 21% in comparison with 1/3 of funding requests in the largest window. Let's go to the next slide, and the next slide will show questions related to sustainability that we have in qualitative survey of each funding request that we conduct. And in the last 3 windows, the TRP observed drop in how funding requests address sustainability. So 2/3 were seen positive compared to 83% in window 1 and 2. So really quite significant drop. And I think that that's also important that the TRP is tailoring the sustainability lens for different portfolios, different contexts. So that might also explain that we have high expectations for sustainability from focus countries. And then when it comes to community systems and response, again, we see a significant drop, that the roles of community-led and community-based organizations in service delivery are less articulated in the funding request in comparison to the first 2 windows. So 61%, which is still relatively high, but in comparison with 79% that we saw in window 1 and 2. Then in the next slide, another element is equity, gender, and human rights that we look and we assess the quality of each funding request based on the equity, based on the gender, based on the human rights. And again, you see the drop in all categories, and particularly I would say for gender, that the maximizing gender equality by considering and addressing gender inequalities and gender-related barriers. This was seen by TRP as less addressed in the last 3 windows in comparison with the first 2 windows. And now, after the qualitative survey, let's go to the next slide. So could we go back then to some messages that we had from the window 1 and 2? So from window 1 and 2, there were several cross-cutting observations that we thought that we will remind you and not try to remake the same observations for the last 3 windows. And in those observations from window 1 and 2, 5 observations were particularly relevant for window 3, 4, and 5. This one of them is the message about prioritization and ambition challenges that remain as allocation budgets are spread too thinly or essential interventions front-loaded, but probably more even so message about prioritization and ambition and challenges related with the allocation budget, what is available. The message that we saw also in quite few funding requests across window 3, 4, and 5 were related to high program management costs that remained of the concern, including that related to equity, human rights, and gender, but not only with that. The third message that we had already from window 1 and 2, and we observed similar tendencies in window 3, 4, 5, were related to collaboration required among partners at country level. For related to the market shaping and introduction of health products, we see that including the upper middle income countries have some challenges faced with market shaping that are particular for those countries. And we see also some challenges with the bringing innovation and new tools to the countries. Little progress seen in private sector engagement despite critical role in responses to sustainability. This is another observation. And I will ask our focal points to speak to some of the elements or examples of these continuous observations that we had in the last 3 windows that are continuing from the window 1 and 2. And first, I will ask our colleague Frank, who is the focal point for efficient and sustainable systems for health. Frank, please.
Yeah, thanks, Raminda. I'm Frank Paulin. Greetings from Heidelberg, where it's raining. I hope it's not raining with you. As Raminda pointed out, there's several challenges identified with ESSH in window 1, 2, and in window 4, 5. We encountered similar. The TRP observes especially that while ISSH gap and priority annex are well developed and structured, priorities identified are often diluted in the funding requests narrative and budgets. RSSH activities are not well reflected in the result framework, and especially no work plan tracking monitor indicators are used for complex intervention that sometimes span more than one GC cycle, for instance, HMIS harmonization, logistic management information system, lab system strengthening, and more. Health financing and health sector governance modules tend to be severely under-budgeted to have a significant impact, especially on sustainability issues identified. The TRP would like to see more investments in national health accounts, including sub-accounts, public expenditure reviews, and medium-term budget and expenditure frameworks. Many Ministry of Health principal recipients face issues with social contracting of community service organizations. Regulatory and legal resolution of bottlenecks are especially important for countries that are focused for transition, where we observe that sustainability plans mostly focus on financial and less on programmatic sustainability. Engagement of the private sector is not prioritized sufficiently. This is alarming as many countries have a strong private sector and are in the process of establishing national health insurance schemes. Health, HIV, tuberculosis, and malaria services are mostly not yet included in the health insurance reimbursement schemes. The C19RM funds have supported countries to strengthen community services through recruitment of community health workers, many of whom by now received multi-skilled training for service delivery beyond HIV, TB, and malaria, such as maternal health and mental health. However, there is a lack of attention to standardization and certification of pre-service training of community health workers that would allow these community health workers to eventually be absorbed into the national health workforce. Many funding requests, including for transition countries, consider RSSH investments primarily to support to disease-specific intervention and less for horizontal system strengthening. Building on the findings of the TRP's 2024 RSSH deep dive and to strengthen countries' progress towards system strengthening, it is proposed that future reviews of funding requests may include a development continuum maturity assessment. Thank you very much. Over to you again, Raminta.
Thank you, Frank, for quite a comprehensive overview of some points. We will maybe move even with shorter elements of the points that we see as continuation from the previous windows. And can I turn to Sergei Vatigov, who is our incoming focal point for equity, human rights, and gender?
Yeah, thanks, Raminta, and welcome everyone, and thanks for attending the session. It's not raining in Amsterdam, unlike in Heidelberg. It's sunny. And from our group of experts in equity, human rights, and gender issues, I will go over first a positive trend that we observe in the overall increase in the uptake and quality of the assessments of barriers related to equity, human rights, and gender in the funding requests. It also translates into a better analysis of those barriers and the role of community systems in better health responses. We believe that this positive trend is due to availability of various assessment tools, including Malaria Matchbox and others. But at the same time, the persistent and remaining challenge for countries is to properly cost, budget for, and integrate recommended interventions to remove EHRG barriers and to strengthen the role of communities in the allocations. This is particularly relevant for focused portfolios, and that might partially explain the drop in attention and quality of the EHRG interventions and programming in window 3 and 5 compared to window 1 and 2. And the overall impression that we have is that in focused portfolios, EHRG and community system strengthening interventions are clearly deprioritized, despite the persistent and structural nature of the barriers related to equity, human rights, and gender, and the risks that represents for sustainability. Thanks, Raminta. Over to you.
Thank you. And I turn then to our ECB focal point, Laura Trevino Duran.
Hi, yeah,
And
good morning. Yeah.
yes, I see that there is something with the translation. I hope that that could be resolved. And I apologize, we are not moving the slides because there are, these are the speaking points and not slides, what focal points are reflecting on. Over to you, Laura.
No problem. Well, good morning or good afternoon to everybody. Just to build on what Raminta mentioned originally, I think, like, you know, with this last windows, what we really saw from the HIV side is that indeed there were still efforts towards, you know, integration, and those were visible. But indeed, what we noted is that they often fail to clearly outline the prioritized packages of those interventions in the different subpopulation of the different groups. And what we saw that there was a lack of clarity on how those interventions will be implemented and even monitored. What we really thought that it needed a more structured and cohesive approach. So that was, I think, important for us regarding integration. The second point we want to highlight, as well building on what Raminta mentioned before, was about prioritization. And indeed, what we saw in the last windows is that the balancing between the cost and the complexity of introducing new innovations against the scope of coverage of those it was a challenge. Especially we saw it in challenging operational environments and on funding requests with limited funding. In those occasions, it was more prevalent, that challenge, and we thought that technical support requires trade-off, and indeed further technical assistance to improve prioritization will be very much needed for the future. Those were the most important points we wanted to highlight among all of them. Thank you.
Thank you, Laura. And I will turn to our focal point for tuberculosis, Rita Gebeleani, please.
Thank you, Raminta, my dear colleagues. About TB and especially about prioritization. So we know that countries continue to face difficult decisions in this context of limited fiscal space, which is affecting notably TB screening, including follow-up screening for key populations and a linkage to care. The countries had to manage trade-offs with mixed results. There are still instances of allocation budgets being spread thinly. TRP also continues to observe gaps in data to inform prioritization of target population for screening for TB, notably data about the size and the prevalence of TB in these populations. Of note is the lack of prioritization guidance for TB. On the bright side, TB preventive treatment continues to be prioritized. Countries and applicants being mindful of the need to combine case finding followed by treatment with TPT, as this combination acts synergistically to further bring down the incidence and mortality by TB. Thank you so much. Over to you, Raminta.
Thank you very much, Rita. And we will turn to Didier Diallo, who is our new focal point for malaria. Please, Didier.
Good morning, everyone. My name is Didier Diallo, calling from Burkina Faso. I'm one of the malaria experts on the technical review panel for the Global Fund. I would like to reiterate some of the observations from my colleagues, especially applied to malaria. Overall, I think on a positive note, there is a trend actually try and follow the normative guidelines in terms of prioritization of interventions, but there's still some effort to be done by some countries which are facing issues in terms of which intervention to prioritize compared to the others. Of course, alliance or insecticide vector control continue to be the leading intervention in terms of costing, in terms of amount of budget that's required to cover these interventions. But that's one of the main challenges in some of the countries, trying to prioritize, give more focus, for instance, on seasonal chemo prevention compared to IT and so case management. So in terms of program costs, again, that's an issue that cuts across all the diseases due to several factors, including the number of PRs and the need to start preparing for transition at the national level, having local national PR to implement interventions. And in that lead to some of the issues, I think, in terms of budgeting. So the budget is very high and affecting the country's capability to earmark some of the resources into key strategies like ITNs or vector control or seasonal chemo prevention, and leading to huge amount of budget being placed into the prioritized above allocation of a funding request. So I'll move probably to the private sector engagement with respect to malaria. There's still a lot of effort to be done. It's a bit slow. There's an opportunity really to leverage capacity of private sector, not only in terms of data collection, but also trying to improve coverage, some of interventions such as intermittent preventive treatment and case management, and also net distribution. In terms of RSH in general, which also in other cross-cutting areas, there's a tendency actually to focus some of the activities into RSH, or I would say limited integration between some of the programs, especially when it's come to training. Of course, there's some effort being done to integrate communication management between TB, malaria, and HIV, but there's still a lot of effort that need to be done in terms of integration, finalize, or to move ahead on that aspect. And especially when it's come to data collection, again, there's a discrepancy between what's happening in some of the programs. With little funding going actually to surveillance for evidence generation for decision making, and which is actually another issue that's cross-cutting to all the other programs. So I think I stop here in terms of Meridas. Thank you very much for listening, and yeah, over to you, Raminta.
Thank you very much, Yadia, for sharing those reflections for malaria specifically. And I know that the recording will be also made available. I apologize for not having like speaking notes sharing, but we thought, we want to make sure that it's clear what are the cross-cutting observations and how we highlight them. So now we will turn to the new observations, as we call them, where we have a bit more in-depth look into what's happening. And as I mentioned before, we have 3 observations, thematic lessons, plus additionally on Gavi and Global Fund Cooperation. So I'm turning to you, Shin.
Thank you, Laminter. Good morning, afternoon, and evening, everyone. Thank you so much for your joining our session. We are so happy to welcome you. My name is Shinsuke Miyano. I'm serving as a vice chair of the TLP. And from now on, we will cover our key observations and recommendations in the TLP review in the window 3, 4, 5. And then first observation point is that urgency of sustainability planning. We have found that sustainability is not given sufficient attention across the portfolio. This is very much evident from the lack of urgency and the preparedness for the transitioning or reducing external donor funding, including Global Fund. And the progress on sustainability plans has stalled even several countries, despite some initial efforts were done during the Global Fund grant cycle 6. And it's very much concerning that some applicants only develop their transition plan when they become eligible for transitioning funding. This is simply too late. However, we also find that some positive example where one country included planning for donor transition and sustainability in their national strategic plan rather than developing separate plan. And generally, when sustainability is considered, there is a heavy emphasis on financial transition from Global Fund support. Unfortunately, other critical dimensions like governance and programmatic implementation arrangements and human rights and gender, those non-financial dimensions are often overlooked. So these broader dimensions sometimes require legal and policy reforms, which are non-linear and unpredictable and take considerable time to effort beyond a single grant cycle. So by the time the applicants are invited to apply for the tailored for transition modality, it's often too late to influence the necessary legal framework. Next, please. Another point is that sustainability of civil society organization and the community-led services are often become a focus too close to the transition period. So transition plans do not place enough emphasis on mechanism to sustain financing and CSOs. And a few applicants from transition countries showed significant progress in their grant cycle 6 plans to build public social contracting for funding CSOs and community-led services to reach key and vulnerable populations. That is the first one. And the second one is that mixed messages about transition timelines are issues for some countries as global fund eligibility changes. So some countries or disease component receive transition funding and then become re-eligible for another allocation again. So that's also creates some mixed messages for the applicants. And the final part is that WTRP tried to conceptualize its overarching review criteria on sustainability to different portfolios. However, it recognized that sustainability transition and co-financing policy and our TRP review criteria might need more tailoring and the specificity to ensure the relevance and consistency in terms of where or in which phase of countries are on their journey to the sustainability. Next, please. So based on that observation, we are moving forward to our recommendations. The first one is for applicants. With the support of technical partners, applicants should include sustainability and donor transition planning in their national strategic plan. This should cover all dimensions of sustainability, that not only financial thing, required of sustainability epidemic control. For Secretariat technical partners, the first one is that Secretariat should provide clear guidance to applicants on the predictability of its transition timelines. And the second point is that Secretariat and technical partners should articulate clearer expectations on sustainability across the spectrum of portfolio, from low income to upper middle income countries, from COEs to transition country, and monitor the progress of sustainability preparedness over several grant cycles. The last one is that Secretariat should explicitly highlight its commitment to supporting applicants' transition that requires advanced multi-cycle planning to shift from national program support to strengthening and eventually to sustainability. Next slide, please. Continuously to the recommendation to the Secretariat technical partners. Technical partners should increase their technical support for initial legal review and reforms that require longer-term planning and preparedness and addressing policy changes for sustainable HIV, TB, malaria programs. And the last one is that in some settings, we also recommend moving to government and national principal recipients for pre-transition or transition grants. Planning earlier is very crucial to allow them sufficient time to develop adequate capacity to manage and operate programs and deliver the services. Thank you for your attention. I hope this presentation highlighted our urgency on sustainability planning and provide valuable recommendations. So now I'd like to hand over to Ernest, and he will explain other TRP observation and recommendation. Thank you.
Thank you, Shane, for your presentation. Thank you, Raminta, for the session. Thank you, Focal Points, and welcome to everybody from wherever you are. The other significant observations from this funding window related to challenging operating environments, with the broad overall thematic lesson for this particular area being the need to include specific human rights context into challenging operating environment definition, as well as the need to focus on developing national capacity. When we look at challenging operating environments, we realize they are often diverse and include countries and settings with either failed states or functional states, the presence or absence of civil societies, as well as those with active conflicts. In terms of the Global Fund definition of what is a complex operating environment, this often focuses on state fragility and humanitarian crisis, whether it is man-made or non-man-made. However, still, we noted that some countries that are not classified as challenging operating environments have human rights crises, which makes programming for key populations very challenging. A specific example is cases where civil society organizations' safety and access to funding are compromised, making them unable to provide services to key population and leading to inability to reach disease control or treatment targets. These crises are often precipitated by changes or rigidity in legal and policy environments. As TRP, we also observed that due to limited national capacity in these challenging operating environment settings, the principal recipient is often an international non-governmental organization, which limits financial and programmatic sustainability, which still remains important in the long run. The specific recommendations linked to these observations to the applicants and the Global Fund Secretariat is the importance and the need for further information on human rights crisis, especially within the context that we've spoken about, including significant reflections from key players, and we want to point out here civil society organizations. This is needed to enhance the TRP review of many of these applications. For the Global Fund Secretariat, we recommend that international NGOs in challenging operating environment countries should include interventions for building the capacity of governments and non-governmental institutions with an eye towards long-term sustainability. An important recommendation for us is countries with emerging or chronic crises for key populations, and in particular, we want to point out human rights crisis, could be classified as challenging operating environments or reclassified as challenging operating environments, allowing TRP to adapt its review criteria. Next slide. Next, we move to refugee and migrant populations, which often and in most contexts do overlap with challenging operating environments. The overall thematic lesson was the need for further emphasis on this significant population of refugee and migrants affected by the three diseases of HIV, TB, and malaria in three important areas. One, in programmatic data, in the improvement of partnership and coordination, and finally, in the development of better health and programmatic solutions for them. The TRP reviewed several countries experiencing human rights violations, stigma and discrimination, as well as the health impacts of war and torture. This came along with diverse health profiles for national refugee and migrant populations. And we noticed that in this context, funding requests often did not adequately address the higher vulnerability of migrant and refugee populations to HIV, TB, and malaria. They suffer often double vulnerabilities from being migrants and refugees, and also specific unique vulnerabilities to HIV, TB, and malaria, especially for those where you have intersectionalities or key populations within the migrant and refugee populations. A second observation was the difficulty in obtaining comprehensive and accurate data, particularly on mixed mobile populations. So under these populations, you'd have entirely displaced persons, refugees, as well as seasonal migrants. We noticed this difficulty made it very difficult for applicants to demonstrate clear programming in their applications for these populations. It is also very difficult for applicants to understand what type of immigrant or refugee they are serving, what is their specific needs, leading to gaps in how they plan and how they implement their prevention, treatment, and care across the three diseases. As TRP, we do acknowledge that it is challenging to identify operational solutions to address health issues in refugee and migrant populations, as well as to address access in both source and destination locations, including the need for periodic screening and follow-up and treatment. We also recognize and noted weak partnerships and coordination between governments, national HIV and TB and malaria programs, and the relevant services important to this migrant and refugee populations, hindering effective health solutions. Next slide. The specific recommendations linked to these observations include: one, the need to invest in and use programmatic data for refugee and migrant populations for much better decision-making and programming. We also propose that this data should be developed and used collaboratively, informed by existing or upcoming studies, developed in consultation with migrant and mobile communities to identify specific components, including population size estimates, migration patterns, socioeconomic profiles, and intersections with HIV, TB, and malaria, and key and vulnerable populations, and the specific intersectionalities and vulnerabilities these create. Out of this, we also noted as TLP that there's no one size fits all. And the important thing is to find creative, locally adapted solutions that are inclusive to address refugee and migrant populations. A specific example given by TLP was the need to develop cross-border agreements and collaboration to improve access to HIV, TB, and malaria services for a migrant population in one application that moved borders seasonally. For technical partners, linked into the need to find creative solution is the importance to document and facilitate the exchange of good practices, of operational solutions and cooperation between countries and organizations that address the needs of refugee and migrant populations. For example, implementation of existing minimum service packages and migration-specific protection from sexual exploitation and abuse in the context of access to healthcare. My name is Ernest Nyamato. I'm the other TRP Vice Chair. And on this note, I'm going to hand over back to Raminta to take us on the next session. Over to you, Raminta.
Thank you very much, Ernest, and also Shin for presenting sort of our key thematic lessons from the TRP reviews. And there is one more observation and key message that TRP would like to deliver, not only from the window 3, 4, 5 reviews, but also from, if we go to the next slide, from something that we have done starting from the last year. So the TRP members served as observers in 29 Gavi independent review panel reviews of malaria vaccines. So that was mainly in 2023, but also in 2024. And in a number of cases, nearly in all cases, we had those participation was, you know, in parallel with the TRP windows and reviewing malaria funding requests from the same applicants, but focused on malaria without vaccines that were coming to the Global Fund. And then in the last window, the TRP review window 5, we had participation of independent review panel of Gavi to come to the Global Fund TRP reviews for 2 funding request reviews for Chad and Mali as the first pilot to understand how we can collaborate from Gavi IRC side, sort of within the TRP processes. And this is part of the element to also align more and recognize that the malaria vaccine role is something that we have to be very much prepared in terms of, you know, what it will, its role in the national malaria programs and responses. Based on this work and our participation and also the observer participation in our reviews, the Gavi IRC observer participation in our reviews, we have 2 overarching messages with some recommendations. One is overarching observation and recommendation is that for the next grant cycle of the Global Fund, so grant cycle 8, Gavi and the Global Fund and technical partners should maximize funding synergies and prioritization by coordinating the preparation of the Global Fund and Gavi malaria vaccine funding requests, particularly where funding is constrained. So we see that it's really major priority for better integration of malaria interventions between different donors, including, of course, with the national funding, but making sure that there is greater coordination. And with that regard, the Global Fund and WHO should disseminate guidance and technical assistance and provide technical assistance to ensure funding requests include information on malaria vaccine strategies when they come to the Global Fund. The Global Fund should consider funding aspects of malaria vaccines delivery, and it's already doing to some degree. And we, that was part of the TRP's participation also in this collaboration. But that's, we see more could be done in terms of supporting malaria vaccines delivery, for example, making sure that resilient and sustainable systems for health, those investments for human resources for health, other health system functions could be, further highlighted in the malaria funding request coming to the Global Fund, and ensure that that there is more coordination and more thinking ahead of the next cycle on these aspects, what practical solutions are needed, given, quite some constraints. So Gavi and the Global Fund have different timelines and duration of funding requests. The application processes and templates are quite different. And maybe, that's something, a signal to revisit and see whether more coordination and overlap could be done. The second message is that it is essential for countries to include malaria vaccination strategy in updated and revised national malaria and EBI strategic plans, and ensure coordination between these programs as basis of funding requests. And we want to give also some specific recommendations that the Global Fund and Gavi could explore more coordination of replenishments for funding of national malaria programs and include malaria vaccines as a core component. And also that as part of the strategy and support vaccine effectiveness, countries could leverage malaria platforms, for example, seasonal or perennial chemoprevention, and applicants should adapt DHAS to systems and national service to assess coverage of malaria vaccinations. And we think that these recommendations will become also quite relevant in the future when TB also vaccine is made available. So therefore, it's important to have dynamic exchange of lessons, and therefore we are presenting them now without waiting the end of the grant cycle. And we are very glad also to say that DIDA has participated, was one of those TRP members who participated in Gavi IRC review, so he can share additional inputs. And similarly, Richard, who is the malaria focal point, other malaria focal point, could share experiences of the from the participation of Gavi IRC members coming to the last TRP windows, and how it worked in addition to the idea also sharing those things. So with this, we are concluding our slide deck and our presentation, and we will be open for questions if there are any, or comments. But so far, I understand that there are no questions and no comments. So probably either everything is clear, or we are hindered also by the fact that we don't have translation, or more questions might come very soon. If you have questions, ideally, it would be great if you post them in the chat, and our colleagues will capture them and project them for visibility to all of us. David, could you help to update if there are any questions?
Yes, I will update if I have any questions. I do see someone whose hand is raised. If they wouldn't mind sharing their thoughts in the chat, please.
So I think that I see one comment from Clarisse Mazon from WHO. regarding Gavi IRC and Global Fund TRP collaboration. Maybe we can project it. And I wonder whether this question is something that Diadia and Richard could address. And I will address that too in terms of RSSH after them. Diadia, would you like to come in, and Richard then?
Yes, please. So the question is regarding Gavi RC and the Global Fund TRP collaboration. We see it was focused on malaria intervention with a bit on service delivery. Has TRP looked also to try and find more opportunity for synergy around RSH between Gavi and the Global Fund? Yeah, thank you very much. I think this is a very important question. I think for the first experience, we really, focus on malaria service delivery, but I think we did also raise the issues where there's a need for some collaboration between, for instance, the different programs, EPI and malaria program, but also the health management information system, because for the vaccine coverage estimation, you definitely need to have the vaccine data element and vaccine indicators into the routine information system platform. So these are areas that we highlighted. It's required collaboration across the RSA system, and it's very, I mean, we really appreciate the point that you raised, the opportunity to raise this question. We haven't explored much, as far as I know, on the trainings and other areas, for instance, in relation to funding. But the issues are really focused, how do we bring on board the health management information system and other key departments to make sure that we synergize effort in terms of data collection and to monitor the performance of vaccine strategies. I will hand it over to Richard. Is he around? So I hope I've responded to your question. Otherwise, we can continue to chat, maybe offline or yeah, if you want. Thank you.
Yeah, and I'd say it's a good comment that was discussed at TRP leadership level. I think this first engagement has been exclusively for malaria vaccines, but I think as both Gavi and Global Fund are essentially continuing their engagement and their collaboration, the coordination of submissions of different country concept notes or proposals, I think certainly there is scope for more, and looking more and including RSSH, other RSSH components that may not necessarily be featured in the malaria vaccine applications, and have a discussion around those as well. And certainly having representation from the reviewer groups from the IRC in the Global Fund proposal reviews and vice versa is really helpful to kind of continue that dialogue.
Thank you very much, Yeti and Richard. From the TRP leadership side, we have started also collaboration with the Gavi IRC leadership and established that we will have quarterly calls. And from the TRP leadership side, we placed a priority that we would like to discuss also potential for discussing collaboration on RSSH investments beyond those that are going for malaria investments. Because also we know that Gavi IRC is a significant RSSH investor, and the countries sometimes not overlap, etc. So that's something that is on the agenda. But and this question, especially coming from WHO, is very encouraging for us to pursue that route. to discuss more specificities. And one of the elements that we had exchanged views on that may be potentially not only for malaria documentation, but also some RSSH documentation that is coming from applicants might be also overlapping. For example, the prioritization of RSSH investments, sort of the RSSH gaps and investments needed, increasing visibility of Gavi RSSH investments. And we will have the presentation to the strategy committee of the TRP's working group on RSSH, which is working on its advisory. This will be happening in July. And, you know, there are also elements that the TRP in its funding reviews, unfortunately, not always has the visibility of the Gavi RC support coming to the countries, and to see the synergies and coordination of those investments, how that is done in countries, to also produce some recommendations. And that comes also to the partial elements with the question, I would say, number 2. I don't know whether anybody else from the focal points or the leadership would like to comment on question number 2, which is asking, or will the TRP advise the Global Fund access to funding how to modify its application template so it is easier to find synergies with Gavi applications?
So, Nisha, are you taking this question, or do you want me to go ahead?
So why don't you comment, please?
Okay. What I might say, my understanding is the funding request is under revision right now, but I don't think was a special case of a discussion, particularly on vaccine. But I guess that's going to be covered during the revision of the funding request, which is I think is ongoing, if I'm correct. But Risha can correct me if I'm wrong.
So just to clarify that I wonder whether access to funding team want to clarify, and I don't know from whom this question came, whether it's from access to funding team or from technical partners. The TRP normally provides inputs in the application templates. I think one element is, as I mentioned, would be also to find whether some documents templates could be overlapping and provided for similar periods of funding, so that there is overlap also in visibility of the same investments, and also the same documents could be used by the applicants to coordinate investments at the national level, which is the key. The TRP will have its working group on the application materials next year, where there will be quite particular inputs in those aspects, but we are in touch with the access to funding to provide also high-level inputs on what is the expectation, and the discussion included also where there should be more synergies and sort of coordination on access to funding materials between the global health donors. Richard, before moving to question 3.
Yeah, I mean, I would say right now, I again, correct me if I'm wrong, Raminta, there hasn't been necessarily a discussion about how to change the application template. I would say, just like any other major donor, whether it's PEPFAR, whether it's PMI, whether it's World Bank, we just would like to encourage all applicants to really make sure that their concept notes contextualizes the whole donor landscape that is there at a country or regional level, that all investments are fully described, but then, of course, also that there is a discussion at country or regional level to make sure that all of these investments are being leveraged to maximum effect. And so that's really sort of generally our kind of recommendation, and that would also apply to any Gavi investments, whether these are in RSSH or whether these are for malaria vaccines. Thanks.
Thank you very much on this. So we will move further to the next question in terms of comparison, how it is done in terms of sustainability and EHRG to arrive at percentages. So the way how we do funding requests quality assessment, we have a standard form that we use for assessing quality of every funding request on several aspects. Those questions that we are posing to assess each review group to assess each funding request, they are deriving, many of them are also continuation of the similar questions from the previous cycle, so that we have continuity and understanding how this cycle of Global Fund grant cycle is comparing with the previous cycle. So in terms of each funding request is assessed on different questions, and then those questions and those assessments have been combined for all funding requests that came to window 1 and 2. And then separately we decided to make a comparison to see whether we see some trends. Then we did all for each funding request, for all funding requests coming to window 3 and window 5, we combined all the quality assessments for all of them to derive to the percentages. And then you saw the questions on sustainability and EHRG, which represents that these are the items that are being assessed in the agreed qualitative scale that is standardized across the forms. Hope that clarifies how it is happening. Like, we normally always present those qualitative assessments. And then moving to the next question about transition readiness assessments. I wonder whether Frank would address question number 4.
Thanks, Raminda. Yes, I will try to address. In window 5, we actually didn't see any country that had a readiness assessment. I communicated with my colleagues, we saw a lot in window 2. And in general, one can say that the readiness assessment was translated into the application. There is, however, a caveat, because it is not clear whether the readiness assessment was tailored to the funding request, or whether it was really an independent assessment that the funding request was then tailored to the assessment. I couldn't really argue that, and I think we would need some deeper dives into the readiness assessments, real development process and how they are being used. Okay.
On integration, good practices on integration, question number 5.
Yeah, we have some countries with good practice, but I think we should not use any country name in this presentation. But we've really seen some good examples where these readiness assessments were integrated into the funding request. However, like I said before, it is not clear whether these readiness assessments were really developed independent of the funding requests, or they were developed to match each other. That is a question. Over.
Thank you. And can I clarify with the person who asked that question, whether it was more on integration sort of in terms of national programs or services, or integration of transition concerns in the national strategic plan? integration of services. So I wonder whether any of the disease experts saw some specific examples and could share whether you saw some practices of integration of services in the last 3 windows. And I think when it comes to good practices, we are quite safe to mention if it is really good practices. So Margaret and then Laura, please.
Yes, thank you. Do you hear me well? Yes. So yeah, we've seen some best practices for integration, particularly in those countries which are now transitioning to universal health coverage, and also in those who are engaged in devolution to the lower levels of the healthcare pyramid, and notably where we've seen good practices. So I will not name countries, but where we've seen good practices is specifically with community system strengthening, where we've seen examples of polyvalent community health workers, which are working across the 3 diseases and even sometimes beyond. We also have good examples for lab or integrated health information management system, not only across the diseases, but also across the different elements. So you have the lab information system, you have the disease information system, you have also for commodities. So all of that integrated and feeding into the national health information system, which can be DHIS2. So we've seen good example of integration at that level. And maybe one last example is coming from the countries which are transitioning towards malaria integration elimination. So we've seen efforts there for integrating surveillance into the wider framework of pandemic preparedness and response and surveillance of outbreak-prone pathogens. So those are the few examples that we can cite. Over. Thank you.
Thank you, Margaret, also for speaking when your voice is somewhere else a little bit. Laura, back to you for examples.
Yeah, maybe just to add on top of Margarita. So basically as well, what we saw in terms of services, like, you know, countries leveraging into existing platforms, like, for example, you know, integrating the scale up of ART sites into existing PMDCT sites that already had a supply system in place and others to make it more realistic. And I think what was very good layout in some places was that the phase approach. They say, well, we are going to integrate, but we are also recognizing that, for example, with triple elimination of syphilis, HIV, and hepatitis B, despite they say normative, we want to do that, but we do know that there is no hepatitis B treatment available. Therefore, we are going to prioritize dual intervention instead of triple intervention. So I think those countries that were able to have a phase approach and prioritize which ones were most relevant, taking into account other challenges of the systems, were, we think, very, very good proposals. That's an example of the ones that we have revised in the latest window.
And Rita, on the same question, and then we will move to the next question, and I will ask Shin to comment.
Sorry, sorry, Ramin. Thank you, Raminta. Just to quickly add the sample collection and transport networks, there is good integration, and also multi-disease screening activities. Over.
Great. Moving to the next question, and Shin, could I ask you to come in because you led the TRP's working group on climate change.
Yeah, thank you, Laminta. So the question is that can there be some standard guidance relating to emergency and displacement resulting from the climate crisis as a part of preparedness and planning for countries prone to climate hazard? Yes, in the current situation, the Global Fund Strategy, the current Global Strategy means the 2023 to 2028, itself is already recognized the climate change as the multi-phase threats to the health that needs to be addressed as a part of like a pandemic preparedness response, PPR, that protects the progress towards ending HIV, HTB, malaria. So that strategy already mentioned that. And then in the guidance level, in the current modular framework handbook for Grand Cycle 7 applications, also provide some guidance to the applicants on the climate change, how to adjust their program or how to mitigate the climate change by showing some example. For example, we can just strengthen the monitoring evaluation system to predict what kind of climate crisis happen. And then if we identify some crisis hazard, we can also prepared to avoid the negative effect to the HIV, TB, malaria program. For example, some countries just already started have the cross linkages with the community people. And then if the climate hazard happen, that their government just communicate community people to protect the HIV, TB, malaria patients under climate hazards. And then, yeah, for example, another example is that they can also prepare some they can prepare the health product management, health product supply for that. What if emergency happen? That's the community people or subnational level, they can also use that stock in the community or subnational level to just sustain the services of the HIV, TB, malaria. That kind of thing happen. But I think we can also, the answer is that we don't have the specific guidance for that emergency displacement resulting in climate change. But the current strategy and current module already provided the broader guidance on the climate change, how to adjust the HIV, TB, malaria program, or how to mitigate the climate change through our program. That is my answer. But if other focal points of leadership can add some comments on that, we are very happy to that.
Ernest, maybe you would like also to weigh in terms of emergencies and displacement. We have seen that also in the last window, I think, quite a bit.
Just to add on, I think Shin mentioned where you can get the guidance. We also get guidance from the challenging operating environment operational note from the Global Fund as well. And we are seeing quite a number of crises, especially in challenging operating environments, especially from climate. In the last review, we did review an application that potentially had one of the worst climate crises seen. I think what we do have flexibilities both for the TRP and the Global Fund Secretariat. And the Global Fund itself also does have an emergency preparedness fund. And all this put together do provide flexibilities for applications for applicants. Thank you. Over to you, Ramita.
Thank you very much for these sharp comments. Rita, is that legacy hand, or you wanted also to come in on this subject?
Sorry, it's just a legacy hand, sorry.
Okay, fine. Laura, I think that your hand is up for this question. So to add it, and then we will move to the question number 7.
Apologies, it was as well a legacy hand, I'm sorry.
Okay. So then moving to the question on gender equality, and I will ask Sergey to come in. Sergey, our incoming focal point on equity, gender, and human rights. And maybe Motoko also will want to comment, who is also focal point on the subject, please.
Yeah,
Sergey?
thank you. With regards to gender equality and the findings based on the gender equality marker being applied by the applicants by the TRP, it definitely encourages greater attention to gender-related barriers. But just like with the earlier comment, the assessments are being made, but they're not being translated into specific programming. We see greater attention to tracking through gender-specific indicators in performance frameworks. But we would like to see more actual programming and budgeting going towards the intervention. For example, there would be great value to specific linkages between disease services and gender-based violence interventions. And also we started noticing that men-specific barriers are also paid attention in some of the funding requests, particularly when drop off the treatment cascade by men or reluctance to seek health services are involved, particularly in TB funding proposals. So these are some of the reflections. And Motoko, if you have anything to add, please step in.
Sorry, not from me. Thank you.
Okay, and maybe I can also add that in the previous cycle, grant cycle 6, I think TRP has been quite consistent in requesting, for example, gender assessments, you know, not necessarily like very comprehensive, but at least light gender assessments. And we see in this window that there is many more gender assessments made available, which become then more basis for commenting on for you know, finding the challenges, identifying the gender barriers, and also identifying the solutions and linking them to the gender aspects. I think that the survey, the quality survey of the funding requests, the data we present, is unfortunate to see that in focus countries, the gender aspects might be not doing as well. In addition to having the lens on gender equality, the TRP, starting from this window, is conducting the gender equality marker assessment, providing inputs, and the data is available and are used and sort of analyzed by the CFG department, so they can probably have a more comprehensive presentation. And we had the pleasure of colleagues from the CFG department just before window 5 to see some visibility of what's happening across the portfolio based on these assessments conducted by the surveys filled by the TRP for the gender marker. But we also understand that the gender lens that the TRP uses in general review and in our forms is something where we are balancing out different aspects. So it remains very much relevant. And when the TRP provides recommendations to applicants on gender, these are sort of balanced in the tough sort of prioritization of what are the strategic actions are needed. And for example, the gender assessments that we have been consistently requesting in the previous windows provide very good basis for tailoring and making very country-specific recommendations on gender from the TRP side. I apologize. I see Ernest's hand on this issue. Please.
Yeah, just a quick one, Raminta. I think you've captured what I was going to say. But just to add, I think one of the key things is as TRP really digging in and asking for gender disaggregated data is something that and just to add to what Sergey mentioned, going beyond just the activities and the tick boxing, as we're calling it, just ensuring that things have been listed, but also digging in and identifying specific strategies and how-tos and impactful activities across the 3 diseases. That's the other thing that we noticed, even for TB and for malaria as well. So just to add to what Raminta has mentioned, you know, a strong emphasis on evidence-based impact of the interventions from both programming perspectives, having the data, but also from the outcome perspective, showing the data of the impact of the work that is being done, and going beyond doing awareness and training, but actually doing things across the continuum from policy to implementation to involvement of civil society, of partners, of women's groups, this particular window, we also saw one recommendation to actually include women committees into TB programming, which I felt was actually a good step in reaching that next point of actually ensuring activities are done over Littleton.
Thank you very, very much for that. And I think that the analysis that also the CRG department adds in is really something important to look back and sort of reflect, but also within the broader context of where the countries are and what is feasible, also within very tough environment and limited allocations, especially for some applicants. We will move to the next slide with further questions. I think that we have more questions on, yes, we have 2 more questions. So the question on missed opportunities on integration, can we have access to detailed TRP comments to understand how to prepare national processes ahead of the next cycle? Anybody would like to step in on this, and understanding that the TRP is the one that is reviewing funding requests, but we do not review the documentation directly related to the national consultation process per se, or like CCM deliberations, or how CCM is organized. But TRP has provided some comments on this before, but I just look at hands of the focal points and others in the leadership to see if anybody would like to kick us off to comment on this. Yes, please, Margaret.
Yes, thank you, Raminta. Maybe just some general comments as far as how the funding requests are being submitted. So what we see, generally speaking, so there is the RSSH gap and priority annex, which aims to really consolidate, as the name says, gaps and priorities across the 3 diseases to develop corresponding intervention to address the gaps that have been uncovered, so to speak, through the consultative process. But we do see that when this is streamlining the scope of a disease-specific funding request, the cross-cutting aspects are not coming across as strongly. So we do see better integration when it is an integrated funding request. Also, we've seen best practices where we have countries which are putting in place a coordination platform or a specialized dedicated RSSH unit at the level of the Ministry of Health to really have an overview of all the interventions which are being implemented, even if it's through the different disease program, but to make sure that really it's cutting across where there are opportunities for integration. So I hope this is helpful. Thank you.
Thank you. Let's go to Richard and then Frank and then Rita, please.
Yeah, a couple of comments here. I mean, I don't think that necessarily there is, WHO guidance out there with regards to integration, how to do integration. It might be much more subject matter specific. For example, how do you integrate HIV services in sexual reproductive health services? That kind of guidance does exist, but not sort of overarching. I think to add to what Marguerite has said, we certainly welcome, well, there are certainly things we would like to see from a point of integration, as she mentioned, but we also welcome innovations that countries propose. So, for example, speaking for malaria, we've seen a couple of concept notes that outlined leveraging vaccination campaigns for example, seasonal malaria chemoprevention, or adding nutrition assessments to seasonal malaria chemoprevention, etc. I think certainly we welcome that, because I think we're all cognizant that countries are facing in some cases, substantial financial constraints. So if they can stretch the investment, whether it's from Global Fund or other sources, further, we certainly welcome that. I think in those instances, though, what we would like to see is that there is a robust monitoring, learning, and evaluation framework that's wrapped around these types of innovations, so that, one, the country actually can assess whether that integration has been successful, and still meets various programmatic goals and targets, and two, also can share the experiences of that integration with the global community, because I think that in itself is going to become more and more important going forward. So that's certainly something that we would recommend, that with regards to some of these integration innovations, countries also think of a robust MLE framework to wrap it around, so that we know that investment has a maximum impact. Thanks.
Thank you very much. We will move now to Frank and then Rita.
Yeah, so I mean, I want to come back to the issue of integration. I mean, what we have been seeing in a lot of funding requests, there are integration issues that span more than one funding cycle. Let's take, for instance, health management information system, logistic information system, supply chain management. These are all strings of activities which span 3, 6, even 9 years. And frequently, countries either have outdated or no well-developed roadmaps for these interventions. And I feel that national processes could actually be initiated by our partner ahead of funding requests development, to ensure that at least these essential strategies and plans are in place. Over. Thanks.
And Rita, please.
Yes, thank you, Raminta. So there is a point which has already been raised by Margherita. It's about the RSSH gaps and priority annex, and also integrated funding requests or multiple funding requests from the same country coming to the same TRP review window. This promoted integration. Also close collaboration between the CCMs and the Ministry of Health and other relevant ministry and stakeholders, of course, including local community. This was deemed by the TRP as critical to develop and sustain integration opportunities. And lastly, there was a recommendation to partners about the fact that applicants need further guidance on what to integrate, where to integrate, and why. So over, thank you.
Thank you very much about sort of highlighting that we need also to be clear what we are talking about in integration, at which level, and also that integration will mean different things in different contexts. One of the elements that we observed also, that we have more integrated funding requests in this window, where the applicant comes not only with HIV and TB or malaria and RSSH components, but also comes with the HIV, TB, malaria, and RSSH together. That has happened, and I'm speaking not necessarily about the last window where we had still such kind of funding requests, but overall across the cycle so far, from window 1 to window 5. One interesting observation that we were expecting that these funding requests will be of higher quality. And what we saw that, yes, we get much better visibility of RSSH investments, of EHRG, of the concerns related to equity, human rights, and gender aspects, sort of an overall picture of the country's thinking in terms of the health sector priorities and where it wants to move and, potential for integration. However, the quality of those funding requests was not rated as high in comparison with other modalities, for example, tailored for national strategic plans. So we have been discussing and providing some inputs to access to funding team in the Global Fund Secretariat, what elements would be needed to help to move things for integration. And some of the messages that are coming is that it's not necessarily that the funding request integration per se would be the key element for integration. This is just the vehicle sort of to simplify and streamline certain processes. But we have to think about integration really at the country level and what elements and opportunities could be done under the national ownership and through sharing some good practices. So with that, we will move to the next question on social contracting aspects. Sergey, could you step in and apologize? I'm also looking like we are trying to coordinate who is answering which question and trying to see if he has responded. Sergey, would you want to kick us off on community system strengthening and social contracting aspects in planning and specific challenges on this? And I think that that also speaks to the next question, so you might want to address both, and then let's see if anybody else wants to step in on those two.
So definitely social contracting or public financing of community-based and civil society organizations is not a silver bullet. Yet from the sustainability point of view, and for the government to really include the contribution from the civil society into the overall health responses, having a mechanism of public financing of NGOs and CBOs or community-led organizations is absolutely essential. But we need to look at the regulatory and legal sort of changes that, and then budgetary processes changes that social contracting would involve in a broader context of the overall policy and legal environment change. Because there are cases where technically the public financing mechanism of civil society organization exists, but at the same time, certain populations who lead certain interventions are criminalized in certain contexts. So yes, it is important to continue efforts to support countries with technical assistance and otherwise in figuring out as early as possible how they could fully benefit from the role that the civil society organizations play through social contracting mechanisms. But we should also be paying attention to the broader policy and legal environment issues to really make it sort of a long-term sustainable solution. Raminta or other colleagues, in case there's anything else to add.
So I think that we can go also to our slide and let me look at which was the number of the slide. Number 16, I believe. Sorry, number 17, probably. So I think that that the TRP really, sees the longer term sort of element that needs to happen. And in that context, we see that we still need to invest and see make the public contracting mechanism as one of the objectives that we are trying to achieve. Of course, understanding the context and understanding that in some contexts, it's really a challenging operating environment in terms of human rights and key populations. But also what we are saying that in some settings, the TRP recommends moving to a separate, okay, I apologize, it's a wrong slide, but to a separate stream where civil society would be leading as needed in channeling funding for key population programming. So yes, in that sense, we have major concerns because we haven't seen as much of the progress, at least in some settings, with social contracting, even in at least one country or two countries that are receiving transition grants, and we're promising quite significant progress in the previous cycle. We haven't seen as much progress happening in the 3 years. And that is part of the challenge of sort of, if 3-year cycle was not good for progressing, what is the next step? Because some of the programming might be, if nothing changes, some of the programming might be returning exactly to the cliff. Either there is continuation if the public contracting is not ready. So therefore, we think that we need to work on both on sustainable solutions, but also have in mind that there might need to be a separate emergency solutions for countries where services will be for key populations will be at the cliff of transitioning out and without availability of alternative funding or domestic funding, given the climate. Yes, do we have further questions? And anybody wanted to comment on the last bit? Frank, please. Could we go then to the question slide?
I just want to add one observation that as long we very often have two principal recipients, one the Ministry of Health and one either international NGO or UNDP, as long and usually CSO and social contracting is managed by the international NGOs or the UNDP principal recipient. Now, if once we approach transition and for sustainability purpose, of course, we want to have the Ministry of Health as the principal recipient for the transition. That means we really have to start 2 or 3 cycles in advance to prepare the Ministry of Health with the capacity to do social contracting, because we have seen very often that that issue just comes up in the last or the second last grant cycle, and then all of a sudden we realize the legislation is missing, regulations are missing, and so on. So, over.
Mm-hmm. And Damien, would you like to voice your comment in the chat on this particular subject? Damien?
Hi, thanks, Raminta. Hi, my name is Damien. I'm an incoming ESSH focal point as well, with an emphasis on health financing. But just wanted to really speak directly to the question that was posed, that we didn't really think that the funding requests were very honest about the challenges, and I've listed, at a very high level what those issues were that we identified, that they were too rushed, too late, as Frank was just saying. I think we heard also from Sugo that they weren't fully costed, but also he pointed to the fact that they weren't really appropriately financed as well, recognizing that there will oftentimes be challenges with the governments themselves financing the continuation of the CSOs, which is what had led to us potentially considering, would there perhaps be a place for a dedicated pot of money, even for countries that have transitioned, to maintain the CSO support in some instances as well. And so that's something that I think we need to give further thought to. So collectively, I think there probably is a need for a deeper dive to better understand what is happening with social contracting, what's best practices to inform and provide better guidance to applicants. Thank you.
Thank you very much for this very clear message and additions. I don't see further questions, but I see also some indication from Lindsay, access to funding team about who are managing, which organizations, which type of organizations are managing the funding requests, the grants on spot. With that, since I'm not seeing any further questions, I will then thank all the attendees for participation and staying with us. I understand that for some there were challenges in terms of the lack of the translation. I hope that that was useful for those who were interested in understanding what was happening in the last year in terms of TRP reviews. We always look forward to the dialogue with the technical partners and with the technical teams. And please indicate us for those opportunities and interest on your side, like how we can arrange those collaboration and continue the discussion. The feedback has been very useful. Also, even the questions posed, they help to clarify quite significant, important elements ahead of also the next funding cycle. And big thanks to all panelists, all focal points of the TRP who helped us to answer the questions, and to the wonderful access to funding team that was helping us to host, to get organized and things. David or anybody else from Access to Funding, any final announcements in terms of the slides or anything else?
Nope. We will be sending these shortly to translations, and as soon as we have the translations back in Spanish and French, we will be sending it to everyone who registered for this webinar, probably next week.
Great. So with that, thank you, and we'll see you next time in different events. Bye.